everyone. My name is Deli Wilder. I'm one of the EVS Apprentice Program student from University Hospital's Avon Rehabilitation Hospital. Today I'm going to show you what is inside my EVS cart, and also I'm going to show you how to set up an EVS cart. So first here, you can see this is our bucket that we use to clean the floor. So this goes behind here, and inside this bucket is our floor cleaner, and we make sure that it's not too much chemical that's in it, because we don't want to waste the chemicals, and we make sure that we always want to keep our floor cleaner fresh. So at the end of the day, before we go home after a shift, we make sure that we empty our bucket, and then so we have fresh chemical in the morning. So over here, I have a microfiber rags, that's what we use for cleaning, and we use two different mops, blue mops and orange mops. Orange mops, we use them for cleaning windows and walls. And this longer, bigger blue mops, we use them to clean the floors. And over here, I have two extra bottles of hydrogen peroxide multi-surface cleaner. We make sure that our labels are accurate and consistent, and the same labels as what type of chemical that's in the bottle. And then this one here is from is our odor counteractant, and if you can see, I have the right label in this bottle. We use this as air freshener. And this one here is our ultra concentrated glass cleaner with the bottles on, and all our chemicals are from Ecolab. And this one is our Clorox bleach from Fusion. Excuse me. We usually just use the bleach, rarely, only for isolation or COVID or chemo precaution. For chemo, we only use the bleach in the sink and in the toilet. So, and this one is our CLR that we use for like stains and something that's in ceramic or like sinks or toilet bowl or whatever that don't come off with our regular scrubbing on regular chemicals. And of course, my gloves, I prefer to use medium-sized gloves. We always have our gloves in our carts. And my plunger, which I use only for sinks when we have clogged sink or anything. Every time we use our plunger, we clean it, and then we put it in a clean bag. And this is our scraper that we use to scrape off something that is like sticky or hard, something that's in the floor that is very hard to come off, that you can't scrub it off, so we use this scraper. And the most important thing that we should have in our EVS cart is our goggles. We use the goggles very importantly when we mix chemicals or when we put chemicals in our bottles or our buckets, so the chemical won't get in our eyes. And also when we high dust the ceiling, when we do high discharge cleaning. And down here I have 4 rolls of toilet papers. I have 1 bottle of each, 1 soap, hand soap. I have 1 shower soap and a hand sanitizer. And I have different rows of bags. The blue bag is used for our dirty linens in a patient's rooms or a therapy gym, whatever place that uses linens. And then I have 2 sizes of bags. I have medium bags, and we actually use 3: medium, small, medium, and large. The small ones we usually use for the patient's rooms or any garbage cans that are bigger and that has the lid on top. And our small size of bag is used usually for open and smaller type of garbage bags. And the larger one, the large size of bags, we only use them for bigger garbage cans and or in our EVS cart. So I just put them underneath here because this is what I usually use it for. Next is I have a bucket that where I use to put peroxide cleaner, and then I have 5 rows of pre-cut or seafoam towels, and then of course in the very bottom is my floor signs. So first I'm going to show you how an EVS cart look like. So right here I'm going to put on the very top part, I'm going to put my bucket on this side, and then our bottles that are already labeled correctly. CLR and bleach. And then make sure that, as we all know, that we always make sure that our EVS carts are all locked all the time when we are not using them. So the next one will be on this side. First, I'm going to put my rags. If some of you may be asking, how many rags do you use every day? I cannot really exactly tell you how much because it depends on how much we are doing and how many discharges we have and how many rooms we have to clean and everything. For one patient room, daily cleaning, I usually use at least 2 or 3 rags. So next will be, so next to this one, I mean, it's up to you. I mean, everybody has different way of, I guess, setting up their carts, but this is how I set up mine. So I put my plunger on top. Next to it is the scraper, and then my goggles. And then I will go on the other side. On this side, I put the small mops for walls and windows. And then on this side, it is the blue mops. Down here, I put this 5 rows of paper towels. I carry most of this because we have a lot of stations and patients' rooms that uses this type of paper towel. Toilet paper on the side. Soaps, hand sanitizer, then my bags, biohazard bags. That's it. It's pretty organized. And then, like we said, always make sure that our cart is locked all the time when it is not used, so nobody can access to what's in your cart. And then the next thing I'm going to show you is this part of the cart. So here we have, this is very helpful. So I put my, I don't know about other facilities, but here we use this sign to put in the door. When we discharge a patient's room, we clip them outside of the door. If you can see here, this is the example of the door, what a patient's room, outside a patient's room, we have that type of sign. So we carry this in our cart too. And then we have this little garbage bags for the patients where, you know, they put their Kleenex and everything. When we clean their room, they usually ask for this type of bags. And of course, our this bags for sanitary napkins, whatever, for the bathrooms, public bathrooms. So we always make sure that we have that available in our carts too. And also, each EVS carts, we have these folders. We use it to put our task sheets or maybe some informations or emails that our manager gave us. So I usually just keep them there for future use. And then also, we use it to store or put our channel guides and our welcome letter, because we put a channel guide and welcome letter and these bags on the tables when we discharge the rooms. And also here, every EVS staff should have this wrenches that we can use to tighten up, like if there's a toilet bowl that's kind of loose and everything. So that is something that's not something that only a maintenance guy can do. Like, we can do it. So our manager was so kind enough and nice enough to give us, each of us, this, so we can do it ourselves. So we always make sure that it's clean and disinfected, and we store them in our carts. And of course, our best friend, magic eraser. We always make sure that we have magic erasers because they work like wonder and magic. So when we clean something that has, like, you know, hard stuff or dark spots and everything, we use it to kind of make it look brand new. And in the back of my cart, I have dustpans and my broom. And like I said earlier, we use 2 mops, so we have 2 mop handles, and of course my high duster. And I think that's pretty much it for today. And if you have any questions, just ask me. And thank you so much for watching, and you have a good day.